everyone. My name is Jessica Casanova, and I am here today to present on psychotropic medications in long-term care. So, what does that mean? Well, psychotropic medications are used to help manage behavioral and emotional symptoms in individuals. While they do not eliminate these behaviors, they support other interventions to improve an individual's well-being and daily experience. Here is a brief agenda for today. We'll go over introduction, categories of psychotropic medication, risks and challenges in long-term care, regulations and guidelines, a brief overview of how that is like, non-pharmacological alternatives, best practices for safe use, effective psychotropic medication management, case study, and some key takeaways. Let's begin by discussing the importance of long-term care settings and the definition of psychotropic medications. To start, long-term care is essential for many individuals whose medical and psychosocial needs require ongoing management. These needs vary, ranging from medical conditions to emotional and behavior support. One of the most effective ways to provide personalized care is by understanding each resident's background. Reviewing the social history the social worker provides or engaging in daily conversations can help build trust and insight in their triggers, preferences, and coping mechanisms. The more a resident feels heard, the more likely they will accept the support and interventions along with their representative party or their medical power of attorney. The definition of psychotropic medication plays a crucial role in long-term care settings by managing behavioral symptoms in dementia, alleviating depression and anxiety, and reducing agitation with cognitive decline. These medications affect brain function, altering mood, behavior cognition, and perception, and are commonly prescribed to treat conditions such as depression, anxiety, and psychosis. However, their use should be carefully monitored to balance benefits with potential risks, ensuring the best outcomes for residents. As you see here, there are several categories related to psychotropic medications. They are antidepressants, antipsychotics, anxiolytics, mood stabilizers, and hypnotics. As discussed before, psychotropic medications are prescribed to help manage specific behaviors, but they do not eliminate them entirely. Instead, their primary goal is to reduce the frequency or intensity of targeted behaviors. Continuous monitoring is essential to evaluate their effectiveness, track behavior patterns, and make necessary treatment of adjustments. A key consideration is identifying the specific behavior that led to the prescription. Typically, the reason for the psychotropic is known as that behavior. When monitoring the behavior, it is essential to 1. Assess how often the behavior occurs after treatment begins, and 2. Document and evaluate interventions. Were they attempted and effective? A behavior monitoring sheet can be made in PCC to easily keep track of the behaviors presented by the residents. Although a behavior monitoring sheet can be generated in PCC in point-click care, here is an overview of how one can effectively be implemented. This sheet can also be reviewed during the psychotropic review process. It provides a snapshot of how many behaviors a resident has exhibited each shift, helping determine whether the prescribed psychotropic medication is effectively reducing the behaviors or if it may not be providing benefit at all. So taking a closer look at the behavior sheet, it provides, the name of the medication, the diagnosis, and what that behavior looks like for that certain psychotropic. And then on the right side, you could see what that behavior looks like, and then you would telemark on each shift, and this could tell you how many behaviors are associated to that psychotropic. Antidepressants are medications known to help with depression. Here is a question to ask yourself. What does that depression look like? To ensure that an antidepressant helps the individual, it is essential to understand and validate their feelings. The feeling of how one may act is the reason and the so-called action that necessitates the use of antidepressant. So, let's return to the question. What does that depression look like? Depression can equal many different behaviors, right? To name a few, here is a list. There's inconsolable crying causing distress, self-isolation causing medical distress due to the lack of interactions, declining activities of interest resulting to isolation, hopeless statements that seem to be out of the ordinary, perseverating on losses, wishing death, trouble sleeping, poor appetite, even easily agitated. As you can see, there are several depression episodes. Communicating with staff, especially those who work more closely, such as the CNAs, is essential, as they consistently assist the individual and often notice those mood changes. This will help to ensure consistency with behavior to be tracked and then added to the care plan, because the care plan will support the documentation. Remember, a care plan is a working document, as changes occur, the care plan will need to be reviewed. Therefore, the changes will need to be added. In most cases, antipsychotic medications help manage behavior challenges. Have you ever encountered behavior that could not be redirected? You may be either smiling or just nodding your head right now. While these medications can help reduce verbal and physical aggression, the key word is reduce. They do not eliminate these behaviors entirely. The care team can help monitor medication use and advocate for alternative behavior management strategies, such as implementing structured routines, utilizing music therapy, and creating calming environments. Administrative services such as nursing and social services ensure that residents and their families understand the risks and benefits of these medications and are involved in making care decisions. These discussions can occur during care conferences or really at any time as needed, ensuring that medication use remains appropriate and supports the residents' well-being. Like other psychotropic drugs, antipsychotics require careful monitoring due to serious risks, including drowsiness, confusion, stroke, and even increased mortality rates in elderly patients. Given these risks, administration staff play a critical role in ensuring these medications are used appropriately and only when truly necessary. This can be achieved through psych pharm meetings, where all residents on psychotropic medications are reviewed to ensure the prescriptions are beneficial. So how do we know who to monitor? Well, the MDS calendar can be a streamlined monitoring of which residents need to be reviewed. Since the MDS typically reviews assessments quarterly, this schedule can serve as a helpful guide. It is recommended to review residents on psychotropic medications at least quarterly and more frequently as needed. Anxiolytics are commonly used to manage anxiety, a diagnosis characterized by excessive worry. Worry can manifest as uncontrollable shakiness, persistent, intrusive thoughts, especially when an individual feels a lack of control over a situation. In this case, being in long-term care. Like any psychotropic medication, anxiolytics require careful monitoring. Interventions must be implemented and assessed before medication is considered. If non-pharmacological intervention proves effective, it should be documented, shared with staff, and incorporated into the patient's care plan, because the care plan will support the documentation. However, if an intervention is only intermittently effective, the nurse should assess the situation and communicate with the physician, providing details on observed behaviors and past intervention outcomes. The physician can then determine whether an anxiolytic is appropriate or not. Thorough documentation is key. Recording observed behaviors, attempted interventions, and their effectiveness helps justify the need for psychotropic medication and ensures informed clinical decisions. Mood stabilizers, such as lithium and Depakote, are commonly used to manage bipolar disorder and help maintain mood stability. However, these medications come with potential risks. Lithium in particular can affect kidney function and requires regular monitoring. Both lithium and Depakote necessitate routine blood tests to ensure therapeutic levels and prevent toxicity. Proper monitoring is crucial for minimizing risk and ensuring safe and effective treatment. Although it is essential to ensure therapeutic levels, behavior monitoring is vital to provide. This will help determine if the medication is needed by assessing the frequency of those behaviors the staff is tracking. Hypnotics are often used to manage insomnia and sometimes agitation. However, they come with risks such as dependency and daytime drowsiness. It is crucial to monitor an individual's sleep pattern to determine whether the medication is effectively improving their sleep or causing excessive or insufficient rest. For example, tracking hours of sleep at night is essential. In some cases, it may be beneficial to also monitor in the morning and afternoon to get a picture of how much a resident is sleeping and if the medication is needed at all. Non-pharmacological alternatives are interventions designed to redirect individuals and ensure their physical and emotional well-being. Understanding a resident's background, including their place of origin, past occupation, and hobbies, can help caregivers identify potential triggers and implement effective redirection strategies. Typically, the social worker compiles a social history based on input from the resident, the responsible party, medical power of attorney, and this document is maintained in the resident's record. If you learn new information about a resident, inform the social worker so they can update the social history. The social history is not just one-time assessment, but an ongoing resource that evolves with the resident's changing needs. For example, during the initial assessment or an update to the social history, the resident may share strategies that have helped reduce certain behaviors. These insights can then be incorporated as interventions for staff to utilize in supporting the resident's care. And again, the care plan will support the documentation. Here are a few things to keep in mind for effective psychotropic medication management. 1. Behavior monitoring and documentation. Accurate, ongoing documentation of behaviors is crucial for justifying the use of psychotropic medication and assessing their effectiveness. Ensure that progress notes, behavior tracking, and care plans reflect clinical rationale and interventions. 2. Psychotropic pharm reviews. Regular psych pharm meetings help identify opportunities for those adjustments, including whether to prescribe or not, or alternative non-pharmacological interventions. These reviews play a crucial role in regulatory compliance and ensuring quality of care. 3. Informed consent. Facilities must obtain and maintain signed informed consent for all psychotropic medications, ensuring that residents and/or their representatives understand the risks, benefits, and alternatives. Because without that consent, unfortunately, that resident won't be able to utilize that psychotropic to help with the targeted behavior. 4. Gradual dose reduction, known as GDR. Per CMS regulations, facilities must attempt GDRs for residents on psychotropic medications unless clinically contraindicated. Proper documentation of the physician's rationale for maintaining dosages is essential. This example provides a psych meeting review, outlining the necessary documentation found in the residence chart to ensure your facility complies with psychotropic monitoring requirements. Avoiding an F758 citation for unnecessary psychotropic medication or PRN use is crucial, as receiving one take can lead to additional takes. This review will support the team in making informed decisions that promote the residents' well-being and align with best practices. As you can see here, psych services is important. We want to make sure that their care plan aligns with our care plan. AIMS is typically handled by nurses. That is something that they'll have to monitor when a resident's on an antipsychotic. Med consent, again, let's confirm that we have that med consent in place to support the psychotropic being prescribed. Pass R2, what do they have one? What is that diagnosis? Because we want to make sure with that diagnosis in the Pass R2 correlates with the point click care. When was the last risk benefit statement? PHQ-9 and BIMS, that's important. That could help decide on if a change needs to be made. Medications. What is the psychotropic? What is that diagnosis? We want to make sure that correlates with their plan of care. Behaviors monitored. What are we monitoring? Because, well, the behavior is the reason for the psychotropic. And last but not least is the recommendation. That's where you could add if there's any changes or if there's no changes at all. So, unfortunately, the use of psychotropic carries risks. We are responsible for complying with the regulations to ensure that our residents remain safe. Some of the risks and challenges are increased sensitivity in elderly patients. Older adults often metabolize drugs differently, making them more susceptible to side effects, toxicity, or adverse interactions. Overuse, misuse risks. Long-term care residents may be at risk of being prescribed medications they no longer need or receiving inappropriate dose frequency. FDA black box warning. Many medications used in long-term care, like antipsychotic, come with a strong FDA warning due to the risks, especially in dementia care. Fall risk, cognitive decline, and dependency. Certain medications contribute to fall risk, sedation, or long-term care cognition issues, leading to increased dependency and reduced quality of life. Regulations and guidelines are established to prevent the mishandling of psychotropic medications. These standards set by CMS emphasize the importance of informed consent, thorough documentation, and gradual dose reduction requirements. To ensure compliance, nursing homes must implement structured systems that uphold these regulations and promote safe medication management. When following the rules of CMS and providing systems, the following are examples of safe practices for safe use. Monitoring effectiveness and side effects, avoiding unnecessary prescriptions, and of course identifying the role of IDT. So here's a hypothetical resident example. I will read the example and then ask you some questions. So the resident information is: the resident has a PRN Ativan order for anxiety related to increased agitation, as evidenced by yelling out and pacing without awareness of where to go. The 85-year-old male has been entering other residents' rooms throughout the night. Despite redirection, he successfully entered rooms 3 out of 5 times. On 2 occasions, when redirection was unsuccessful, he responded with statements such as, "Leave me alone." In response, the CNA gave the resident space while observing from a distance. Shortly after, the resident sat alone at a table without interacting with others. When approached 5 minutes later, he appeared calm and requested water. So here are some questions to keep in mind. What behavior should be monitored? Is this intervention appropriate? And when should the Ativan PRN order be given or should it even be given at all? So here's a brief intervention analysis. The non-pharmacological approach, including redirection and space allowance, appeared effective, as the resident ultimately calmed down without further escalation. The Ativan PRN order should be considered only if the resident's agitation persists, escalates, or poses a risk to himself or others. In this case, because the resident was able to self-regulate and engage appropriately after a short period, administering Ativan may not have been necessary at that moment. Continued monitoring is recommended, with Ativan reserved for situations where distress is severe and non-pharmacologic interventions are ineffective. Here's a summary and some key takeaways from the presentation. Psychotropic medications do not eliminate behaviors but support other interventions aimed at improving residents' well-being. Understanding each resident's social history and background helps build trust and allows for personalized care. Key types of psychotropic medications are antidepressants, antipsychotics, anxiolytics, mood stabilizers, and hypnotics. Proper documentation, continuous monitoring, and staff communication are crucial for effective medication management. CMS regulations emphasize informed consent, thorough documentation, and gradual dose reductions to prevent unnecessary medication use. Non-pharmacologic alternatives such as structured routines like music therapy and understanding individual preferences play a key role in reducing reliance on medication. Other key takeaways are understanding your resident and their background and daily interactions, and the daily interactions help provide personalized care. Regular monitoring and documentations are essential for evaluating medication effectiveness and ensuring compliance with the regulations. Non-pharmacologic interventions should be prioritized before medication. The ID team must collaborate to ensure safe and appropriate medication use. And that concludes my presentation. Please feel free to reach out to our team. We would be more than happy to elaborate or provide additional education if needed. Thank you and have a good day.